I know you're just the messenger, but I give you a little more credit than that. All right, you guys, you're joining me now in our lovely Granite Transformations green room. It may feel like spring outside, but the truth is we've still got a few more days left of February, right? Which means it's American Heart Month. So we wanted to do a check-in about the signs and symptoms of a heart attack, some things we need to know as women. So our favorite Dr. Mary Gillis joins us. Mary, if you'd show everybody your dress, because we look like twinsies this morning, don't we?
I think blonde hair, the blue, and then honestly kind of the shoes. So yes, you look lovely in blue.
Now, is there anything scientific behind that when you start to dress? Amber and I have done this several times.
Oh my God.
Alexis and I used to do it the more we work together. What is it about working together that makes you dress alike?
That makes so much sense, Vanessa. There's a scientific term. It's called synchrony. The more time you spend with someone, the more time you think alike, the more time you agree on things, the more time you dress alike.
Okay.
So we're in
my
synchrony.
husband and I even kind of do it too. So that's good to know. Well, we have a lot to talk about. I mentioned it was Heart Month. It's always good to have a pulse, no pun intended, on the stats, the signs, the symptoms, and more than anything, how we can prevent that. So start us off with the stats. What is it that we need to be reminded of?
Well, the first thing is the statistics. It's the #1 killer in Indianapolis, or Indiana.
Wow.
20% of people pass away due to some sort of heart disease. And that's alarming. You know, that's a lot. You know, it doesn't have to happen.
Well,
Vanessa.
and that's the thing. A lot of it's because of lifestyle choices. Is that right?
And yes, exactly. So you know all about this. One of them is eating right.
You're talking about the dietitian in me. That's
You're
what
an
she-
RD, right? You're the dietitian. So, and everybody sees your lovely recipes that taste good, and you know I've experienced it myself. So,
well, I appreciate that. I like to say the closer to the farm, the better. But it's like we do need those daily reminders. It's common sense, but is it common practice? So.
Right. That's a good point.
It is a good check-in. And then I'm sure exercise too. Is that another one?
Exercise too. Everything counts. Everything counts.
So is it like something's better than nothing? Is that what you'd say?
Yes. And we have these guidelines 3 times a week, But okay, just go. Just do it. Do whatever you want.
Dr. Gillis is like, just to start walking, right?
Just walk around the block.
Okay.
Okay. You'll get some health benefits.
Yeah. Love it. Okay. What else, lifestyle-wise, can we do when it comes to prevention?
Well, I think other things too are, of course, our mental health is, take a breather, take some, stress off your plate if you can. I know it's a tough time to do that, but all of those things, they're all connected, right? Brain, body.
And along with that, what are the numbers that we always hear the term, I hear them every February, know your numbers. What does that mean? Can you decode that for us?
Anessa, you are absolutely correct. We want to know our numbers. Our numbers include our blood pressure. We want to know our blood pressure. So there are ways in which we can look at that. Of course, you go to your doctor. We have these other things that you can pick up at your pharmacy. We want less than 120/80. It's a number. Just look for the number. We don't know what it means. It doesn't matter. Just look for the number. And all these lifestyle changes will help it go down and drop. The second thing is we want to know our heart rate. As you mentioned earlier, Nessa, we do want to have a pulse. The pulse needs to be within a range. If it's too high, 100 beats per minute at rest, you have something called tachycardia.
Okay.
Over 100 beats per minute. If you have if you have one too low, less than 60, it's called bradycardia. So you want to be aware, and you think that the lower the pulse, the better. Not always. So you got to want that range.
Right, and it's not anything that you would necessarily feel, right? It's good to get those regular check-ins with your doc.
You could have no idea. Because it's different than palpitations.
Yeah, okay. I know that we want to you talked to somebody recently who gave us some insight. Who was that? And we want to show that video.
Lovely Camuel Wright, Dr. Camuel Wright from Care Source here in Indiana, and she was lovely to speak to. So let's toss
to her. Look at that now.
I think what's important is that women oftentimes don't recognize that they're at risk for heart disease, so they don't necessarily get the testing that they need, and then they don't get on the medications that's important. And unfortunately, that can lead to poor outcomes. I think the other factor is that sometimes things like heart attacks can be more difficult to diagnose in women because the signs are not the same as for men.
All right, so she mentioned the signs aren't the same for women and men. What's the difference?
There are differences between men and women. And the interesting thing is these differences are quite distinct. So women will experience nausea, vomiting. You can easily think that that's something else. We can see jaw, neck, or back pain And that's similar to men, but still something we want to know about. Chest pain, not always. Pressure in the lower abdomen.
Fainting is different for women. I know we've only got a few seconds left,
Right.
but I love this graphic.
Fainting, indigestion,
this is extremely helpful.
fatigue. Right, there we go.
Okay, Dr. Gillis, remind us where we can follow you to get more information.
Dr. Mary Gillis, follow me on Facebook.
She's
Thanks for the
available.
shout out.
She makes it easy. You simplify it for us. We appreciate you. We'll see you back next week.
Thank you,
right?
Vanessa.
Okay, thanks for taking care of our hearts. Hey.